From ABC News World Headquarters, this is ABC World News with Diane Sawyer. Reporting tonight, George Stephanopoulos.
Good evening. Diane is off tonight after a day of double trouble for the White House, scrambling to defuse not one but two firestorms. The president accused of making false promises, even lying about Obamacare. That was on one side of Capitol Hill. On the other, that spy scandal intensified, with new calls for a total stop to spying on friends. So what did the president know? How much damage has been done? And what will he do now? Thanks very much. Now to another big fight for the White House, the president accused of breaking a key health care promise. Millions of Americans learning they will lose their current insurance coverage, and for the first time, a government official is apologizing for that botched website. ABC's Jim Avila reports from Washington.
For the first time, the Obama administration issued a direct apology for healthcare.gov.
I want to apologize to you that the website has not worked as well as it should.
But there is no apology for the latest dust-up over Obamacare.
If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor.
But for 14 million Americans who buy private health insurance, that may not be true.
Now they're being told they can't. That's a lie.
Julie Prince just received a letter from her insurance company saying her private plan no longer exists.
I'm not going to be able to afford anything if I ever get sick.
Why is this happening? Because insurance companies which offered cheap insurance like Julie's left out basics now required by Obamacare, like hospital coverage, maternity, mental health, or prescription drugs, and are now forced to cancel those plans and replace them. Julie's new premium would be $210 a month, 3 times more than she pays now if she takes the insurance company's alternative. But 3 independent healthcare experts tell ABC News Julie and the others are likely to find plans just as cheap or cheaper on the marketplace when it's fully functional and with better coverage. Julie tells us that she doesn't have hospital care on this cheap insurance plan. Is that dangerous?
Absolutely. That's an enormous hole in her coverage.
Oversold or big lie, as the president's opponents contend, the White House says America's underinsured will be better off with Obamacare. Jim Avila, ABC News, Washington.
Well, thanks to Jim for that, and we move on now to
This is the CBS Evening News with Scott Pelley.
Good evening. The head of the agency that oversees the government's health insurance website appeared before Congress today. Marilyn Taverner, the administrator for the Centers for Medicare and Medicaid Services, apologized for all of the problems with the site. She placed the blame on tardy contractors. That did not satisfy members of the House committee, who were frustrated when Taverner would not answer some of the key questions. Nancy Cordes is on Capitol Hill for us tonight. Nancy?
And Scott, the main thing members wanted to know was how many Americans have managed to navigate this system and actually sign up for insurance. They asked her dozens of times, but she wouldn't answer.
I want to apologize to you that the website has not worked as well as it should.
Marilyn Taverner insisted today the Obamacare website's poor performance had nothing to do with her unwillingness to share enrollment figures.
We will not have that till mid-November. We have people who are shopping now. We expect the initial number to be small.
How small? Taverner wouldn't say. Originally, the administration had aimed to enroll 500,000 people in October alone. Committee Chairman Dave Camp.
But it doesn't look like you're even meeting your own projections that you had prepared.
Taverner took over the Centers for Medicare and Medicaid 8 months ago.
Well, can I tell you, my constituents are frightened.
Republicans like Kevin Brady of Texas argued her relatively small agency simply was not equipped to implement a huge new law.
So what I can guarantee is that we have a system that's working. We're going to improve the speed of that system.
Excuse me.
Yes.
You're saying the system right now is working?
I'm saying it's working. It's just not working at the speed that we want and at the success rate that we want.
Taverner blamed the website's flaws on delays by the main IT firm hired to build it, a Canadian company called CGI. But in an apparent contradiction, she told Georgia's Tom Price that the site's massive problems on day one caught her off guard.
The problems that we saw in the first week, we attributed to volume. Once the volume started back down a little
How about before October 1st? Was there any sense at all that there were going to be problems with the website?
No, not. There are always going to be issues with a new website, what I would call the customary glitches that you see, but no, not this.
That is not what the website's designers said when they testified just last week. They said the site crashed when they tested it gently just 2 weeks before the launch date, and that they told CMS officials all about it, Scott.
Nancy, thanks very much. We wondered what the White House has to say about that system crash 2 weeks before the launch. Major Garrett's been asking around about that. Major?
Scott, we asked David Seamus, a top healthcare advisor to President Obama, how it was decided to launch the healthcare website when the administration knew it had failed some key early tests. Who decided to go ahead with the launch when the site crashed with fewer than 200 people on it? And was the president notified that that crash occurred so shortly before the October 1st launch?
There was rigorous testing, but Major, look, there wasn't enough.
And there had to be a decision to say, go ahead once that site crashed problem.
It's clear now that there wasn't enough testing. And the bottom line is that the President of the United States last week went out in front of the American people and said, here's what we're going to do to fix it. And the good news is, even when it's up and running, we're still going to have until March 31st to make sure that people are covered.
Did the president know?
So we received updates in terms of the progress, and it was all systems go on October 1st.
White House advisors say consumers angered at having to switch their individual insurance policies after the president promised them that they could keep them can find better alternatives and possibly cost-saving subsidies on the federal health care website. They'll be a lot easier, Scott, when that website is fully operational, and that won't be for at least another month.
Major, thanks. Those policies Major mentioned are being canceled because they don't meet the minimum standards set by the new health care law. Correspondent Jan Crawford confirmed with insurance companies that more than 2 million Americans are getting notices that they can no longer keep their policies, including 279,000 in California, Michigan 140,000, Florida 300,000, and in New Jersey 800,000. If the purchases on the Obamacare website are small, as that agency official predicted today, what does that mean to insurance companies that need large groups of policyholders for their plans to work? Cheryl Atkinson is looking into that.
Evergreen Health of Maryland is a nonprofit insurer that got started with a $65 million loan from the federal government. Just days into the enrollment fiasco, CEO Dr. Peter Bielenson had to blow up his business plan.
We actually called a meeting immediately upon learning of these difficulties with the exchange of our entire 35-person staff and said, listen, guys, we're going to have to switch our marketing strategy, our strategy of how we're going after folks.
Just reaching out to you to discuss your health care.
That means forgetting about individuals for now and instead targeting small businesses the old-fashioned way with phone calls and TV ads.
Neighborhood care, same-day appointments.
The 23 small co-ops across the country that are part of Affordable Care are intended to provide competition. As they adjust to stay afloat, some analysts worry that Obamacare, as designed, might not. Their biggest fear is that with the website problems, more of the enrollees will be the sickest and most motivated. If that happens, insurers would have no choice but to raise premiums, and that could cause more healthy customers to flee. In the insurance industry, it's known as the death spiral, and experts say if that were to come to pass, the Obamacare business model would collapse. Bielenson says he only knows for sure of a dozen people signing up for Evergreen so far.
If we have 1,000 members at the end of the year, that will be a problem, but we think we're far along in our business planning, and we expect to have about 15,000 or so, which would be our break even.
For context, Scott, the Affordable Care Law is counting on signing up 7 million people over the next 6 months. That averages to about 39,000 people a day.
Cheryl, thanks very much. Now to the other controversy in Washington, the U.S. government's...
The O'Reilly Factor is on tonight.
Will you admit that when the president said, if you have a plan, you'll get to keep it, that was not true?
President Obama coming under withering fire because Obamacare is not what he said it would be.
He knew he was lying? Probably. But that's one of those political lies, you know.
Tonight we'll analyze this stunning situation with Charles Krauthammer and James Carville.
Is the administration so wed to the October 1st launch site that you didn't provide enough time for testing?
Kristen, we're focused not on Monday morning quarterbacking.
Jay Carney has perhaps the toughest job in the USA defending Obamacare. Bernie Goldberg will tell us how he's doing.
Why can't they just opt out? If they don't want to say "so help me God," they don't have to say that part.
Well, it's like saying, why don't you just opt out of not robbing a bank?
And the Air Force caves in to the demand of anti-religious zealots. Crowley and Combs on that case. Caution. You are about to enter the no-spin zone. The Factor begins right now. Hi, I'm Bill O'Reilly. Thanks for watching us tonight. Is it all unraveling for President Obama? That is the subject of this evening's Talking Points memo. Things are getting very bad for the Obama administration. It's not a partisan statement. That is reality. The president's signature issue, affordable health care, not so affordable. And even if you want to sign up, the computer chaos makes it very hard to do so. But the main problem is President Obama himself. For years, he's been saying to Americans, they're not going to have to undergo pain when the health insurance changes.
First, if you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable.
Well, for many Americans, that's simply not true. The initial data is clear. Health insurance premiums are going up for many working Americans, and health insurance companies are literally tossing people off the rolls. There's no question that's happening.
From that podium, will you admit that when the president said, if you have a plan, you'll get to keep it, that was not true?
Well, let's be clear. What the president said and what everybody said all along is that there are going to be changes brought about by the Affordable Care Act that create minimum standards of coverage. So it's true that there are existing health care plans on the individual market that don't meet those minimum standards and therefore do not qualify for the Affordable Care Act.
So even the president's spokesman, Mr. Carney, now admits Mr. Obama was not quite accurate in his previous statements. The question then becomes, did the president knowingly mislead the nation?
Obama knew, even at the time he said it, there was no guarantee everybody was going to keep their insurance because people couldn't keep their insurance under the old system.
So he knew he was lying when he lied?
I'm sorry?
He knew he was lying?
Probably. But that's one of those political lies, you know.
Talking Points not convinced Clarence Page, a liberal, is correct. Here's what I think happened. Mr. Obama brought little critical thinking to the table on Obamacare and pretty much talked himself into a scenario that he wanted. That is, that government can control the American health industry with little consumer downside. Now, I'm not making excuses for the president. His vision clearly has harmed many of us, and he will pay a steep political price for that. But at this point, I am not willing to say that he intentionally lied. The evidence says he simply did not want to know the truth, nor did he seek it. A little bit of a difference here. It's subtle. And now even the liberal press is reporting negatively on Obamacare.
For many middle-class Americans who buy their own health insurance, there could be another frustration, and that is sticker shock, after some learn they must buy new policies that cover more but cost more as well.
That millions will lose or have to change their individual policies is not a surprise to the administration. NBC News senior investigative correspondent Lisa Myers found buried in the 2010 Obamacare regulations language predicting a reasonable range for the percentage of individual policies that would terminate is 40% to 67%.
Again, the question is, did President Obama know about the regulations and the language in the report? I don't believe he did because he didn't read it. He doesn't pay attention to details. Now, before you write me damning letters, what I'm saying is far more damaging than you think. If the President of the United States is not paying attention to details, this country's in huge trouble. As Talking Point said last night, and that memo was posted on BillO'Reilly.com, the President simply answers he doesn't know on far too many occasions. It's your job to know, Mr. President, and being ill-informed puts all of us in danger. One of the weaknesses of liberal philosophy is idealism. Liberals want certain things, such as low-cost health care for everybody. But they don't really calibrate the unintended consequences of what they espouse. For example, imposing so-called social justice, a big Obama theme, means somebody's going to have to pay for it. If you go to Cuba, you'll see most people are destitute because the government has taken everything away from everybody in order to level the playing field. We'll all be poor together. No government can provide without resources, and because the government creates nothing, they have to take the resources away from people who have them. That's what we're seeing with the Obamacare chaos. Working Americans with individual health insurance policies will generally pay more for their health care in order to subsidize the 30 million uninsured Americans. President Obama was never upfront about that. Now millions of Americans are shocked. The bill is due, and all hell is breaking loose. Talking Points believes President Obama will not recover from the health care debacle and that it will weigh Hillary Clinton down as well as she gets ready for her presidential run. Watch how she distances herself from Mr. Obama, because over the next few months, the Obamacare situation is going to get worse. The law never should have been passed. Nobody really understood it. Few read it, and the Supreme Court upheld the law on faulty reasoning. That is the truth. And now all of us are paying the price. And that is the memo. Next on the rundown, Charles Kraft.